Thank you very much, Donna. Good morning, everyone. It's an honor and pleasure to be with you here this morning, and it's a special honor and privilege to be able to introduce our senior United States Senator, Senator Shelley Moore Capito. So I'm going to say a few things about Senator Capito. You know, I think often we become so familiar with one another here in West Virginia that we forget the significance and talents and commitments of those around us. And I don't want to do that in the case of Senator Capito. You've just heard a couple nice testimonials from Nancy about what Senator Capito has done nationally. So let me just remind everyone of this remarkable asset and friend of all of us in West Virginia. Think about this. Senator Capito has served in the U.S. Congress for almost a quarter of a century. I kind of had to check my notes as I was preparing that. So 14 years in the House of Representatives and a decade now in the U.S. Senate. She's our senior United States Senator, a ranking member of the Senate, and a respected leader among her fellow senators. Here's some of the things that you should know about Shelley, and this is, as we know Shelley, because she's so personal, engaged, and present everywhere all the time, like the Energizer Bunny with all of us. But this is how America and maybe the world knows Senator Shelley Moore Capito. She served on the Appropriations Committee since 2015. She serves on the Commerce, Science, and Transportation Committee. She chairs the Environment and Public Works Committee. She serves on the Rules and Administration Committee. She is chair of the Senate Republican Policy Committee, the fourth highest position in the Senate Republican leadership. Importantly for all of us at this event, Senator Capito currently chairs the Labor, Health, and Human Services Education and Related Agencies Appropriations Subcommittee, where she oversees funding for a large range of programs within the U.S. Departments of Labor, Education, Health, and Human Services, as well as several independent agencies, and she has chaired 4 appropriations subcommittees. I submit to you that's a lot of firepower in one person, and she's ours. So that's what the world knows about Senator Capito, but what do we know about Senator Capito that the world may not know? What do we know about our native daughter, and why is she so effective? So Senator Capito is a daughter, a sister, a wife, a mother, a grandmother, and a friend. She was born in Glendale to parents whom she and her siblings would later care for as they aged. And like many of us, Senator Capito has faced the tender and frustrating challenges that loved ones encounter, from helping with dressing and grooming to sorting through finances and medical appointments for her mom and dad. Senator Capito and her husband Charlie reside in Charleston, which is my hometown. As Shelley will tell you, every time she goes to Kroger, it takes her about 2 hours to get through because she bumps into everyone she knows and everyone stops and has a question for her. More importantly, Shelley stops with every person, knows something about them, asks about them, and demonstrates that care and compassion that she has for each of us. And it doesn't just stop with that care and compassion. She turns that into action at every turn. As an example, and a notable example, Shelley, in recent years, she started attending a lot of Parkinson's support group activities in and around West Virginia and Charleston. Based on that, she co-sponsored federal legislation regarding Parkinson's, which quickly became law, one of the quickest bills to move through the United States Congress, and that was Shelley's brainchild and effort based on her personal connections in West Virginia. She knows that there are real people behind the policies she's involved in. That's why she is so effective. In her leadership role, I would remind you, as we think about health, as the top Republican on the Labor, Health, and Human Services Appropriations Subcommittee, she has provided powerful and constant support for cancer, diabetes, mental health, biomedical research, and much more. Her work has not gone unnoticed. She's been nationally recognized for her work on Alzheimer's, Parkinson's, and cancer, just to name a few. She also focuses on the reality of West Virginia as a rural state. So she has supported broadband, as Nancy just mentioned. She's been a passionate advocate for Medicare and Medicaid improvements to cover people and provide care that makes a difference in all of our lives, the ability to get a doctor, get early screenings, get medication. She's helped build facilities across the state, healthcare facilities. She's helped provide funding for deliveries to women in poor and rural areas across the state. She's provided funding for the training of dentists. The list goes on, and as Nancy just mentioned, she's a co-sponsor federally of legislation, the Credit for Caring Act, that addresses the significant cost of cost sharing. So these are just a few of Senator Capito's accomplishments. I could go through a much longer list of economic development, energy, and much, much more, equally impressive, but I'll stop here because you want to hear from Senator Shelley Moore Capito. It is my pleasure to introduce our friend, my friend, our great United States Senator, Shelley Moore Capito. Shelley.
I just told Tom that was way over the top, but thank you. Thank you very much. Let me pull this down. Well, good morning to everybody. It's great to be here in Morgantown. This is, I believe, the second time, Rocky, that I've addressed the Focus Forward. Thank you for the invitation. It's great to be here with my former colleague, Joe Manchin, and Gail always. Gail, thank you for your service at the ARC. I would, since we're talking about longevity, point out that the average age of the Senate is now 64.7. It went down after Joe left, so thank you, Joe, for leaving us in better spots. I will remind everybody what you already know. I'm above the average, and I'm fighting hard. A lot of people have been asking me because of the environment in Washington, the pace at which things are going, and the just all over the board kinds of issues that we're dealing with in Washington. You know, how are you doing? How are you handling all this? And isn't it tiring? Doesn't it wear you out? Yes, it's tiring. Yes, it wears me out. But I tell you what really wore me out yesterday. Taking 6 little kids to the White House Easter egg roll. I collapsed at 9 o'clock. I was so tired. And for all the women in the room and grandmothers and mothers in the room, the phenomenon that I do not understand is, why was I walking with the 6 children and the adults with my husband were having a nice conversation way behind me? That's a phenomenon we need to do something about. Gail, I'm sure that's happened to you as well. But we had a good time at the White House egg roll, and it's one of those things that you like to say you did, and it came through. It was fun. We had a good time. So I want to thank you all. I want to thank my friend Tom Haywood, as I already said, for the very nice introduction. I was thinking about the times I've gotten stopped in the Krogers, and one time I got stopped at the Green Peppers, and it was not a very pleasurable experience. So I always go quickly past the Green Peppers and hoping I have better luck. And there's a lot of angst out there right now, so it's always a good barometer for what people are thinking. Some people are very excited about the shrinking of government and the president doing what he said he was going to do, and all different kind of measures of the policies he's put forward, emphasis on energy and border control and all those kinds of things. And then there's others who are very put out with a lot of that. Maybe not the border so much, but particularly the DOGE issues and some of the other issues that the president's gotten involved in. So I'm getting it both sides of the arguments here, and I like it. I like to hear. I have to hear and want to hear what's on everybody's mind. But today we're talking about longevity, and obviously, as we're all aging, it's something that gets more and more important as you get a little bit older. And I want to thank Donna, your efforts with the West Virginia Public Education Collaborative and the Benedum Foundation. Jen at the Benedum Foundation, we grew up together, basically, although I'm old enough probably to be her mother, because my very first experience as a congresswoman was representing Randolph County, and Jen was a very young, energetic economic development administrator for Randolph County, and she's just done such a wonderful job. So I feel like, you know, we kind of moved into our positions together. So we're talking a lot, and obviously we have the health experts here talking a lot about health and how it's intertwined to not just family life and community life, but to the economics of our country. We have a movement, Make America Healthy Again. And we see the Secretary of Health and Human Services, Robert F. Kennedy Jr., going in a lot of different directions, some directions that I think are causing some concerns, other directions, particularly on the food and additives issues, very much in line with concerns of young mothers with children, but also all of us as we try to figure out the best way to age and take care of ourselves, but also have our diets reflect the healthiest part of us that we possibly can. So very supportive. I will say this about him. I was in a meeting earlier with the NIOSH folks. He's very responsive on the phone. He is very quick to respond. And that's the kind of leader I want. But I'd like him to do everything I want. But so I do want you to know that we do have good lines of communications there. So when I think about all of the things or some of the things that I've done in the healthcare space, I'm really well positioned. It's always been a passion of mine. When it was asked who's a caregiver or who's been a caregiver or who's a future caregiver in the room, I raised my hand because I thought about the years that I'd helped with my sister and my brother with my parents as they aged in Glendale. Many of you have heard me tell the story. But my husband Charlie's here with me today, and he leaned over and he goes, "Did you raise your hand because you're going to be caregiving for me?" I thought, well, I don't know, Charlie. We don't know which one's going to go down first. Although I have been caregiving for him because he broke his wrist playing what sport? Pickleball. It's the orthopedist's dream. We should have a whole section on pickleball for seniors to see the best way for us to stay safe. But anyway, I've been very active both from my Senate Health Subcommittee standpoint. We're getting ready to go into appropriation season. Hopefully it will be more functioning, better understood, more reliable than it has been. I can't promise you that. I would like to. John Thune, who's the new leader in the Senate, has pledged that we will have appropriations bills onto the Senate floor for considerations. But we have this thing called congressional directed spend. Many of you have asked us to help with your communities, hospitals, and other areas to be able to, for me to direct federal dollars into your facilities for help. We've done quite a bit up here at WVU, just cut the ribbon on or started the renovations over at the dental school of several, I think it was $15 million that we got the dental school. Well, in the 2025 budget, we had an additional $15 million for the dental school for them to complete. Dental school, by the way, looks the same as it did in the 1970s as it does right now, and it's our only dental school, and it's such a huge asset for us. But because of the way we did appropriations this year, all of those congressional directed spendings fell by the wayside. I don't want to see that happen again. So hopefully we'll have a functioning and a better functioning and more predictable appropriations season. I've spent a lot of time. I just started the Senate Caregivers Caucus. Nancy talked about the 40 million unpaid caregivers in this nation. We know West Virginians always take care of their families or try to as best that they can, to their economic demise sometimes, to the physical and emotional draining of caring for family members that need care, and it's happening all across the nation. So I found the best thing for me, and there's some people in the room who know who they are, that when I felt at my lowest, trying to figure out what to do with my parents and how to cope with this, their Alzheimer's at the same time, support groups and caucuses and being able to talk to people who are in the same situation cannot be overstated. And I know they're going on in every community here in this great state. So I wanted to have those kinds of conversations with my fellow senators because they're happening in every state, they're happening with every senator. And so we meet occasionally, and we do have advocacy for our caregivers, which obviously the child tax credit, or not child tax credit, the caregiver tax credit that we're trying to get into this new tax package is going to be exceedingly important for families. We got to get a foothold in there. We've got to be able to make sure that the economics of caring for your families, because we know if you can care for them in their own home, if you can keep them out of more expensive healthcare situations, it's better economically, but in a lot of times it's better from the health and emotional standpoint of not just who's getting cared for, but also those who are caring for them. So that's the point of that. We've also done some other things in terms of legislation. You know I'm very passionate about research. I'm very passionate about innovation in healthcare. AI, I think holds enormous prospects, and I'm sure we're going to be talking about that today. But I want cures. I want a cure for Parkinson's. I want a cure for cancer, all cancers. I want a cure for Alzheimer's. And the way to do that is to make sure that we have the research, we have early diagnosis. We see a lot of things happening in the Alzheimer's space in terms of new drug development, early diagnosis, and we see it right here at R&I, the amazing work that they're doing there. So I have the Change Act, which is really to encourage the early assessment and diagnosis. You know, you get that, when you turn 65, you get the Medicare for All entry-level interview with your caregiver. Why not put the early assessment into that so that we can begin to maybe stave off some of the devastating consequences of still a mysterious, I think it's mysterious, disease as to who and how will get it and how it will develop. I can tell you from both my parents, they had totally different types of dementia as they moved through it. So it was an interesting and really, really sad experience. Another thing that we found for caregivers is to try to navigate Medicare, Medicaid, PEIA, health insurance, pharmaceutical coverage. All of this is really daunting to a caregiver that hasn't really been the principal person who signed up for a lot of these things. So we put forward the ABC Act, which is to try to help caregivers sort of eliminate all of the and have these agencies coordinate better when you're trying to get the right kinds of assistance to the caregiver to help. What kind of benefits does this person have? Does the VA, do they have Medicare? Do they have an additional drug plan? Do they have, what types of things could this coordinating of these different entities help a caregiver get to that will ease not just their angst in trying to figure out the best way to do this, but also the economics and the time and the energy that it takes to move through this. So this is requiring them to review their processes and procedures and to try to reduce the administrative burden on caregivers. It sounds easy, doesn't it sound easy? But government sometimes doesn't do the best in terms of moving us quickly. I've also been, I picked up this issue, about half the room will identify with this issue, the other half will identify in a different way, but menopause has not really been studied and unlocked in terms of how women go through menopause, what types of therapeutics are the best, and what kind of support. So I'm really interested in advancing this Menopause and Midlife Women's Health Act to try to unlock some of the mysteries, to try to put the money and the emphasis into a part of life that every woman is going to go through in a whole different types of ways. So I've joined with a lot of my fellow senators, male and female, to try to help with a time in a woman's life, or part of a woman's life, that can be very stressful or not. And so I think we need to figure out some of the best ways to deal with that. I've also gotten involved, and I came here, I know Clay Marsh was here, I think he still might be in the room. There he is. Hi, Clay. We went over to the Children's Hospital and we talked about the Children's Cancer Act, the STAR Act, another bill that I co-sponsored with Jack Reed, and we're now into the 5-year reauthorization. In learning, and I learn all of this every day, in learning this, as our childhood cancer victims and survivors age, they've got a lot of things going on in their lives that really haven't been studied as well as they can. What the therapies that they had when they were young children to stop their cancer and cure their cancer in a lot of ways has effects throughout the rest of their life. And what happens in an adult body is not the same thing that happens in a child's body when you're doing treatment and when you're focusing in. And WVU with the Children's Hospital here is a really great resource. We were able to talk to some of the families and some of the children. And you want to wake up in the morning and feel grateful for yourself, for your life. Spend a day with families and children who have childhood cancer. That's a tough card to be dealt in many ways. So the STAR Act goes to research. It also goes to looking and following the longevity of our childhood cancer survivors as they move through really difficult times. So those are some of the snapshots of some of the things that I think will lead to the longevity portion of our conference here today. Obviously, healthier lives are better lives and more fulfilling lives and emotionally happier lives, so that then the whole mental health crisis that we find ourselves in can alleviate a little bit. We need more professionals in mental health. I've done a lot, and Joe and I did a lot when we were together in the Senate on substance abuse and mental health around substance abuse, PTSD and suicide for our veterans. I mean, the space to really make sure that we're not just living longer but living better is so big and broad that I think all of us can have a niche to fill, and I certainly feel that my service in Washington, through my service in Washington, I can help fill that niche. I do want to say one last thing before I finish. There's been a lot of announcements from the White House, executive orders, things that are sometimes puzzling, sometimes, yeah, we should have been doing that anyway, moving at a really, really rapid pace. One of the areas that's been under, and I know WVU's feeling this because I've talked with them and a lot about this, is the research with NIH, and Dr. Lee knows all about this. And there's a question as to whether NIH research, through the actions what the president is pulling back on, and I don't want to get into the details of it because it's kind of complicated, but it's pulling back on some of what are called indirect costs, is that the research will suffer. Well, I'm not going to stand to have the research and innovation suffer. I don't want to see the things that we do in this country so well, that we do right here in this state, in terms of health innovations, health cures, health research, health investigations for rural America, huge, the cancer rates that we have here. I'm not going to stop and be a party to anything that reduces our ability to research and innovate like we do as a country. Because if we don't, other countries will, and we should. So with that, I'll say hang in there, and I appreciate the wonderful turnout at this. Is just amazing to see. I have a lot of my team here with me today. Many of you know them. I hope you know them well. They're all in and out and around the state because they're my eyes and ears. We've been in Washington quite a bit. Joe, you would not miss that aspect of it. We've been in Washington quite a bit over the last several weeks and months. And it doesn't look like it's going to slow down. But you know what? The one thing I will say, despite my age, I got a lot of energy, and I get it from you. So thank you all very much.
Thank you very much, Senator Capito, for all that you do and for being such a fierce fighter for innovation and research. You saw the recognition and response and applause. So, and I mentioned earlier that you've received some awards, and you're about to receive one more award here today. So at this time, I'd like to call to the podium Tom Retzlaff, who's the Chief Policy Officer at the American Association of Cancer Research. He'll be accompanied by Dr. Ming Lei, who's Vice Dean of Research at WVU School of Medicine, for an award. Thank you.
Thanks so much, Tom. And Senator Capito, on behalf of the more than 50,000 members of the American Association for Cancer Research, which includes our esteemed member Ming Lei, and who also serves on our Science Policy and Government Affairs Committee, it's my privilege to present to you the 2025 AACR Distinguished Public Service Award. You are being recognized for this today for your longstanding leadership and dedication to the life-saving research that the National Institutes of Health and the National Cancer Institute supports and provides funding for the thousands of researchers and physician scientists all across the country, as well as for your authorship of the single most important pediatric cancer bill legislation that passed, the Survivorship, Treatment, Access, and Research Act, which directed $120 million for pediatric cancer research and survivor support, and your recognition for the importance of partnerships between the NIH, NCI, and the academic community, such as West Virginia University. As chair of the Labor HHS Appropriations Committee, you have been a champion for both medical research and for patients with cancer all across this country. So with that, we want to thank you so much, Senator Capito. Thank you. We don't want to drop it.
Yeah.